We are live. I think we're just waiting for everyone now to register or to log in. There they come.
Okay.
Okay.
People are coming in now faster than when they went to the beach after phase 4.
Okay, we've got people joining us from Durban. Dr. Nowbath from your side of town. We have someone who says, "Hi, Nobs. Great to see you again, Yaku."
Yaku.
Ah, we finally have some people joining us from Johannesburg. Thank you. Ah, Bloemfontein has even come. Good afternoon. Port Elizabeth. Pretoria, welcome. Cape Town, great. More from Cape Town. Pretoria, Randburg. Hi, welcome, Sharon.
Wow.
Great. Centurion. Lots from Pretoria today is good. Even from Melbourne, welcome. All the way from so far away. Thank you.
Wow.
Bedford View, Witbank, fantastic. More from Durban, Dr. Nowbath, that's great.
And the Boxburg people from you?
We're already here.
Oh, they're there. Okay.
All right. Everyone from the East, yes, welcome. We finally have some people. Benoni, great. From the universities, UJ, Pretoria, Peter Maritzburg, welcome. Bloemfontein. Great. Well, welcome everyone, even from Lenasia, welcome. Okay, I see people are still logging in. I'm going to give 1 or 2 more minutes to everyone to log in, and then we can get started. We even have people from Bethlehem, welcome. Boskrane. More from the East Rand, which is great.
I trust that's coffee, Neil.
Yeah, because we're not allowed to drink anything else.
Howick and Durban, great.
Wow. The Falls.
Fantastic. Eldorado Park. Melville, fantastic. Welcome to everyone. Greenpoint in Cape Town, Centurion. Got a lot from UJ, which is great. Thanks for joining us. Okay. And people are still logging in, even from Alberton, Margate, Sunninghill. All right. And welcome from Modderfontein. We've got from Crosby. Thanks to everyone who's taken their time on Friday to join us with this discussion. Thank you. Okay, we're going to give 1 more minute till everyone joining, and then I think we're going to get started. Okay. Okay. All right, I think we're going to get started at least with the introductions and the opening. Please, I encourage everyone, if you have questions, please put it in the chat box, and we will make sure to try to answer as many questions during the session as possible. Good afternoon, everyone, and welcome to the Mail and Guardian webinar. Thank you very much to our sponsors, Dr. Reddy's, for giving us this platform and this opportunity to talk about such an important topic that is both very emotional and sensitive and quite controversial, but it's an important topic nonetheless. COVID-19 pandemic and the lockdown has left many South Africans feeling overwhelmed, anxious, stressed, depressed. And for those that depend on alcohol, tobacco, or drugs as a psychological coping mechanism, may find daily lives even more challenging. I think especially with the lockdown that was originally 3 weeks and then the extension and the further restrictions during alert level 4, this has all had a profound impact not only on individuals, but families and colleagues. So today I'm joined by two of our esteemed experts to really unpack the implications of the alcohol, cigarette and substance use during COVID and lockdown, and really understanding the link and the impact on mental health. So this afternoon, I'd like to introduce our psychiatrist, Dr. Nowbath, who is in private practice and joining us from Durban. He is a Wits undergraduate, so we can take that from Gauteng, and he sits on the executive of the South African Addiction Medicine Society, as well as the Durban Chess Club, and is a member as part of SASOP, the Psychiatry Association. And then our clinical psychologist this afternoon is Neil Amoore, who is in private practice in Benoni on the East Rand, specializes in addiction, mood disorders, personality, has extensive experience and work in the field of trauma and PTSD amongst police, the Gambling Association, and more importantly, the Substance Abuse Network of South Africa. So thank you to everyone for joining, and we're going to dive right in. Dr. Nowbath, I'd like to start with you to perhaps help set the scene. The purpose around these restrictions on alcohol and cigarettes during lockdown and now alert level 4. Maybe you can unpack how this restrictions, what the purpose is.
I think the thinking behind it initially was good. The intention was to reduce mobility and people moving around, to reduce a host of medical problems that arise from the use of cigarettes and from alcohol. Now, we saw that initially. When the lockdown started, there were far fewer admissions to hospital as a result of drunken driving, motor vehicle accidents, sequelae of drinking too much and using too much alcohol. The coronavirus is a respiratory virus, and we know that smoking affects the lungs, affects the respiratory system. So it made sense at that stage to limit and to prevent. But the thinking behind it was actually to prevent mobility, morbidity that came and from there. And that was the reason for the initial ban on cigarettes and alcohol use. The other part of it was that when people were locked in at home, if they drank excessively, the risk there was gender-based violence, given what's going on. So that was the original thinking behind the ban. And then subsequently it changed. We'll get into that now.
Thank you for that. And I'd like to really just to set the scene and paint the picture. Neil, from your experience, what have you seen as the impact of these bans around mental health or during lockdown? What have you been seeing during this time?
I've seen impacts at so many levels. I mean, if we look at the fact that not everyone that is using these substances, especially alcohol, maybe more than cigarettes, is necessarily addicted, but their capacity to use it, the function that alcohol plays in their life, whether it's from a social perspective or whether it's used as a form of self-medication, has had an impact in terms of how these folk are functioning. So what I've certainly seen is that the folk who, especially smokers, are, for example, engaging in behavior that effectively is criminal behavior, when they're not necessarily prone to criminality themselves, and that is in the acquisition of cigarettes and having to buy them on the black market. But a massive impact for me has been the fact that these are folk who are dealing with underlying anxiety and depression anyway, and so the alcohol and the cigarettes have formed a part of a coping system or a coping matrix for them over time. And as that has been removed, there's been an anxiety around the fact that there's a depleting stock that they've got at home, that is a problem for them. The fact that their own mood is starting to deteriorate as a result of that. So we're seeing, certainly in my practice in the hospital, we're seeing folk who are presenting more with anxiety and depression, that there's an exacerbation in those symptoms in a lot of these folk. And that there are folk, for example, as Nowbath was saying, is that there are folk who are in situations where, for example, they're in abusive homes, where the alcohol has been removed or it has been drunk, and there's been that that has gone on, and there's been a lot of abuse in that space. That even though the alcohol is now run out, the abuse hasn't necessarily gone away. That in fact has continued because there's been the withdrawal and the anger and the exacerbation of the underlying mood conditions. What I've also seen is an increase in suicidality in patients, suicidal ideation, certainly in my practice. I've seen in the last week alone, I've had to deal with at least 5 or 6 suicides, and these are younger folk as well. And in some cases attributable to substances, but I think in most cases attributable to the emotional pressure that's come with lockdown and the oppression emotion that is created for folk. And so when we've removed these coping skills for folk who are not necessarily addicted or to the level that we might require treatment, that it's exacerbated mood and exacerbated difficulties.
Yeah, I think a real concern there on the number of patients and the increase in suicide. We at SADAG have noticed our call volumes since lockdown have literally doubled during this period, and on a number of different issues. Dr. Nowbath, from your side, are you seeing more cases? What has your experience been about the effect of alcohol or cigarette bans during this time?
You know, the problem is that this is a difficult time overall. People are not at home, they're not working, they're not exercising, they're not socializing. Your life's been turned around completely. For lots of people, this is particularly difficult. There's loss of income, there's a threat of unemployment going forward, and all that causes anxiety, depression, and that's very real. There's a real cause for this. At times when people go through stresses, what do? They reach out to their comforts. Lots of them get relief from a cigarette. Lots of people get relief from having a drink. And what's happened now is that they've been prevented from doing so. Now, as far as smoking is concerned, if someone doesn't smoke, it's not going to kill them. Yes, they're going to get irritable. They're going to go into nicotine withdrawal, which is difficult and uncomfortable, but they will adjust slowly. The problem is there are many people who use cigarettes as a default. They were addicted to other drugs, like things like cocaine and ecstasy and heroin, and smoking became almost a safer default option. Now, for many of those patients, if they don't have cigarettes available, the risk there is a relapse, certainly, of the original condition. And that's a problem. That's one of the issues that's come up. I'm thinking lots of people who are grappling with, I get calls every day. How do we manage this? How do we cope with this? There's no cigarettes available. What are we going to do? Alcohol's somewhat different. And it affects different people at a whole lot of different levels. The full-blown alcoholic who's dependent on a daily drink, who needs that, is likely to go into a withdrawal, which is a medical emergency, needs admission to hospital. The social drinker who has the odd drink, if he had his birthday and this time wouldn't have a drink on his birthday or on Mother's Day, he'd be able to cope. But there are a lot of people where alcohol, daily drink, is part of their routine. It marks the separation between work and home. So you get back home, get your feet up, sip a drink before you have dinner. Now, lots of those people by now have run out of alcohol. They told to stock up initially for 3 weeks, and they got caught flat-footed at 7 weeks down the line. Suddenly, in that situation, they're being denied what's a simple pleasure. They're not drinkers. So at that level, they challenge, certainly challenges. You want to go ahead with?
Yeah, I think you've mentioned a couple of key things, and I really want to start unpacking the impact of the withdrawal, both on mental health and also you mentioned medical emergency. Maybe you can just further discuss and give comments on those that have had forced withdrawals and having to stop cigarettes and alcohol. What kind of physical symptoms are we going to be seeing, and what kind of withdrawal are they going to be going through?
With the alcoholic, I've had a couple of patients admitted already who've gone to full-blown withdrawal. Now, if you're dependent on your daily dose of alcohol and you don't have it, in about 72 hours, you're going to start craving. You have a range of physical symptoms, tummy upset, sweating, tachycardia, and finally you get your full-blown DTs, your delirium tremens, marked by hallucinations, aggressive, agitated behavior, perceptual disturbances that come through at that point. these guys in full-blown withdrawal, and that's a risk. They need admission to hospital. They need to go into detox. They're going to get into the ward. They go through a benzodiazepine detox, they get nutritional replacement. And that's one end of the spectrum. That's a severe condition. It's a medical emergency. And many of those people who go into the alcoholics didn't have and don't have the resources to buy alcohol for 3 weeks. They get enough for the daily bottle of however much they drink. And they've been caught out. So I have had admissions because of that, as far as the alcohol is concerned. Then there have been other patients who are not alcoholics, but enjoy a drink on a regular basis, a daily drink, who've struggled in the situation. Now, not everybody experiences lockdown in the same way. We're a disparate society. Not everybody has the benefit of a garden, tons of books to read at home, a pool outside. The patients in lockdown, I saw someone this morning in my room. She's got 10 people locked into a 2-bedroom house, and there's no space outside. So what happens there? Now, in another situation, you've got people who've got access to things. They can get out, they can do things. They can even afford to pay for the contraband liquor. I know someone who bought 2 bottles of cheap brandy at $500 a bottle. Right? So that's 1,000 rand spent on cheap brandy. I know others who are brewing their own. In the last few weeks, if you went to the supermarkets, yeast, the premium, pineapples you couldn't get, because people are brewing their own liquor. Then you've got all the illicit brews in the market that have come through, and they're dangerous. People die as a result of it. That's the problems that we get to see, and we have been seeing across the board.
And that's quite severe. And I think, Neil, to pose to you now, I mean, understanding the impact of withdrawal and possibly increasing hospital admissions, are we likely to see that in the longer that these restrictions are in place, are we likely to see an increase in the number of people being admitted for withdrawals or medical emergencies for both alcohols and cigarettes?
I think we will. I think for me, a critical point for me, and one that maybe isn't necessarily made enough, is that there's a vast distinction between somebody choosing to go through a rehabilitation process, choosing to come off a drug or of any form, and this being forced upon them. So there's a massive psychological shift that is required here. Now we've got folk who haven't necessarily committed to this process for their own good, and so they are going to go through various stages of distress as this goes on, because now there is a forced removal of something that they've actually come to rely upon. On top of that, there's a growing anger, because now I'm dealing with withdrawals that really weren't my own or my choosing. And as this continues, I think that there's going to be the worry that we would have. There's going to be a gradual decompensation or disintegration of the coping skills that folk have put in place. And the folk that didn't choose to go into this as a willing participant in terms of rehabilitation haven't got those in place yet, don't necessarily even have the support of their families at this point. So the worry is that it's also going to exacerbate sort of underlying difficulties in family dynamics. The other thing is that when we look at it from that perspective too, and to go back to what Dr. Nowbath was saying, is that we've now got folk who are going to need emergency medical care. Is there enough strength and structure within the family to get that help for those folk in that time? Is there enough understanding and support within that space? Are there enough facilities? We're struggling out here. I know rehabilitation centres have not necessarily been able to admit. So where do we take these folks? So, our wards at the moment have got a number of patients admitted to them because of alcohol withdrawals. And so I think the limited resources are not helping either. And so that is a problem with substance abuse in this country anyway, is that are people conscientized enough around what is available, what isn't? And now we have lockdown. And so the structures that these folk fit into are going to struggle too. And so to come back to the point around a voluntary rehab, which this is not for most folk, I just am gravely concerned about how folk are then going to emotionally cope with further delays, which again are not of their own choosing, and are going to exacerbate a sense of helplessness and a sense effectively of lack of agency.
And I think such an important point there is that substance abuse in South Africa was already a major issue. Not enough resources, not enough settings and facilities. And I think maybe now, I know both of you have been working throughout lockdown and throughout alert level 4, the implications of more people going into hospital, needing admissions, dealing with the the anxiety and the trauma of that whole process in itself, what other extra measures are now in place specifically because of COVID-19? Maybe we can start with you, Dr.
It's absolutely difficult to get a patient into hospital. They come to hospital at this time, they initially screened, and now for an admission, they've got to be swabbed. Then they're isolated for about 2 days before you get a negative result coming back. Then they only are they admitted. Right? That's elective admission. And lots of our patients are elective admissions. So you get a patient going through that process, then you get them into hospital. All hospitals that I work at do not allow visiting patients. So patients don't get any visitors in hospital. They're isolated because the numbers are down. So Neil probably find difficulty running groups in hospitals and programs there, because you get people together, you get isolate people, separate them, and keep them apart. And that's the difficulty. So to get someone into hospital now is something you don't really want to do. But these are difficult times. There's increased levels of anxiety, depression, all this coming through, and people are struggling. Now, ideally, we'd want to manage them at home if you can, because the lockdown was never meant to be punitive. The intention behind it, right? It was not meant to do this, but that's what's happening on the ground. Now, I've had patients come in during the lockdown with overdoses, with suicide attempts, and attempted hanging in this time, simply because of the stresses of coping outside. Lots of this depends on whom you lock down with, what your circumstances like and what's going on there. And resources are not readily available. Many GP practices outside are seeing limited numbers of closed their rooms. So it's difficult to access care. It becomes a nightmare to even get an admission done, especially with the regulations. In Durban, we've had hospitals that have been closed as a result. St. Augustine's and Kingsway Hospital both closed because they had positive patients in there. What happened to psychiatrists who work there, patients would normally have been admitted to hospital in this time. It's not as though you've got COVID-19 and everything else just falls away. Because especially with mental health, that's on the increase right now. Which is,
Absolutely. And the UN and recently the WHO have actually released really heated warnings around the impact of mental health and the crisis that's looming. Neil, do you want to add anything to that about some of the time?
Yeah, absolutely. I mean, I think that what Dr. Nowbath is saying is absolutely critical. Is that it's a triage space now. I mean, you've got patients that ordinarily you would admit because they're in severe distress and it's a psychiatric emergency. Now you're having to manage it in a threefold way. You're having to manage it in terms of their initial admission, in terms of COVID being screened, but in that same process in isolation, having to manage folk that are psychiatrically, emotionally, psychologically in great distress and still keep that level of stability. Then put them into a hospital setting where we now, because of COVID lockdown regulations, we have limited facilities available to them. So it's really created a tip of the spear point, in the sense of you only have a small percentage of folk that are being admitted. And the worry for me, if you look at what's happening in the States at the moment, is that, and they call it the deaths by despair or deaths of despair, where folk are, suicides, and mental health clinics in the States apparently are closing, some of them, because they are being overwhelmed by this, because there aren't necessarily that many inpatient facilities. So it's gravely concerning, because we're going to sit with more patients, but with less facilities available to them potentially. And what happens when the mental health staff in hospitals potentially fall ill, because of COVID-19 as well? That just puts the system at even further pressure.
And I think, some of the questions that have even come up, and I think we're going to start addressing them and helping us to answer them. Just to remind everyone that is logged in, we do have a poll. Please go and have a look. It is on your platform that you can just click on. The question is, how do you feel about a graded lifting of the cigarettes and alcohol ban? Your options are yes, it's about time, or don't care, doesn't really affect me, cigarettes first, alcohol first, or both cigarettes and alcohol ban to be lifted together. Please do go and fill in the poll. Just before the end, we will also just look at the answers again. I'd just like to go through some of the questions that have come up already. Is asking, so we've got people who are now withdrawing from home. They've had to stop cigarettes, they've had to stop drinking. How do we help manage these symptoms from home, especially for a loved one or a family member? What kind of tips would you give? Maybe, Neil, I could start with you.
if we're talking about alcohol and cigarettes, well, the primary concern for me with anybody who's using a substance, especially at a problematic level, and cigarettes, to my mind, would feature in this field, is what function does the substance play in that person's life? Does it connect, is it probably will to some sort of emotional process? Is it, as Dr. Nowbath was saying earlier, is it the end of the day ritual, something that allows me to de-stress and sort of compartmentalize my day? Are there other issues underlying this as well? Is there depression and anxiety? Are there other stresses? What is the function of the substance in this person's life at this point? So one of the key things we have to do is to not focus entirely, for a family member or loved one, is not focus entirely on the substance. That's critical. But that what we have here is an opportunity to see how that person is functioning generally. Are we actually engaging in sort of mental health hygiene practices? Are we making sure that our sleep is taken care of, our exercise? Are the relationships in the home functional? Is there a problem with conflict resolution? Are there effective strategies for coping with the stresses that we're having to deal with? All of this in the face of the uncertainty about whether these substances will come back. These problems are going to remain anyway. These are things that we have to start to deal with. So we would want you to start reaching out. If you have a therapist, continue to see your therapist. If you've got a psychiatrist, continue to see them. Reach out to health professions where you can. But ultimately, because those are going to be limited, as we were saying, is we want to start maximizing the resources within the home. So relationship dynamics, staying in contact with folk, looking at how we manage the emotional fallout from withdrawals as well as the physical. What is the emotional stuff that'll go with that? Are we effectively, one of the concerns we have is quarantine fatigue, as it's been put, I suppose, in our case, lockdown fatigue, is the gradual sort of disintegration of our daily structure. Why do we have to get up? What is the point? What's the function of everything? I've determined my week now in terms of yesterday, today, and tomorrow. I'm not even sure what Wednesday looks like anymore. I don't know what that is. So with that gradual disintegration, we start to lose our shape. We start to lose our form. And that's happening for everyone, irrespective of whether we're on a substance or not, but it's much worse for someone who doesn't have that reliever. So we still want to identify that. We want to maximize the structures and the dynamics within the home. So communicate, open up, exercise, diet, sleep hygiene, all of those functions are going to be absolutely critical to be focused on.
Dr. Nowbath, can you maybe help on some of the physical symptoms?
Echo all that Neil has said. Hobbies, learn to play a musical instrument, play chess, whatever. Get all these things in place. But there's also things like other assistance that you can get to cope with that. In the old days, we had Nicorettes, a nicotine gum that you could chew. There's sweets that you can have. Drink lots of water. It certainly helps. Then you can go into medication. We have drugs available for the treatment of nicotine addiction. There's Zyban on the market. There's Champix of Varenicline on the market as well. So these are things people have. They've got to see a doctor, get a script for that, and start on that, certainly. But it's got to be part of a holistic package. Now, with cigarettes and tobacco smoking, I remember the old days when I worked in the state facility. In all the long-term wards, we had a budget for tobacco, which the state provided. We gave patients tobacco because we knew that in patients who were schizophrenic, it reduced the level of agitation and anxiety and irritability. So it actually calmed them. Now, that's what we did. So I don't know what's happening in those places now. There's a total ban on smoking in that environment. It's almost draconian legislation that's come through. We're not going to start unpacking the contraband cigarette market and the politically well-connected people who are selling these products, the illicit cigarettes. But in a situation at home, people are going to go through the smoker by now would have gone through that initial phase, the irritability, the nicotine withdrawal, the anxiety that comes with it. For many people, the positive might have been, that's a good time to have given up. To be honest, that probably has happened, many of them. But we know that at times of stress, people who smoke get a lot of relief from it. And they've been denied that now. So it's a double-edged sword.
I think it is a conundrum, and jump in, please.
Sorry, can I jump in there? Just to build on what Dr. Nowbath was saying in terms of the cigarettes, for example, schizophrenic patients. I've worked in rehabs on and off for over 20 years, and I can tell you now that it's effectively sort of standard practice is when patients come into treatment is to not suggest that they try to give up smoking at that time. That is something we can deal with. But the stress and the anxiety that they go through in giving up an illicit drug is significant, and the life changes that are significant. And so cigarettes in that space, and I'm a non-smoker, so I'm not advocating it from that perspective. The benefits are significant. It's from a mental health perspective, it makes your job harder very often with a patient that has now got that excessive level of anxiety going on top of everything else.
Absolutely. These are difficult times. The level of anxiety is increased. There's tons of depression all over. It's the last, period in which we can tell people, well, stop smoking now. There's so much they're going through anyway. That's a
Yeah, and I think it's compounding what everyone is going through. It's another thing that is taking away as a way for people to cope. And I think, one of the interesting things that we've seen even from SADAG is, and what you mentioned, Dr. Nowbath, about the total ban of cigarettes in, say, residential homes or NGOs that are looking after people with severe mental illness, is that it is really difficult for them. We've had many discussions with NGOs who are desperate. They have 200 residents who only had 2 cigarettes a day, but it was, from the morning and the afternoon, and they banked on that to help with their anxiety. Now, since the lockdown, they had, obviously these NGOs have planned for it, the extension, and now alert level 4, you have 200 very distressed, very agitated patients. And it's become incredibly scary for a lot of NGOs who are desperate and are trying to find different ways to help them. And I think also one of the questions that have come up is, some of the ideas also given are really great and practical, and I think it empowers a lot of people. We also know that in our economic climate at the moment, there isn't resources, there isn't a lot of money, people losing jobs. They really are holding on to every penny. What kind of free resources or self-help tips can you give someone who's possibly withdrawing or having to reduce how much they're smoking and feeling more agitated during this time? Any ideas or tips for free that people could do from home to help them manage?
I defer to Neil.
You said for free, so that's the magic word. Of course, that's how it works. Well, I think there's still facilities available, and I think that if you look at, for example, from a behavioural point of view, something that I often say to folks is that if you look at your smoking, is pace yourself, very obviously, work within your limits, but look at your ritual cigarettes if you can. The ritual cigarette in this context would be one that happens at a very particular time of day, first thing in the morning, last thing at night, after a meal. The association between the cigarette and the time of day is quite critical. Work out which cigarettes you can effectively start to do without, where you can, without distressing yourself to the point where you remove everything. But again, start to substitute a negative behavior with a positive one where you can. You have to provide that. I'm not sure that I'm going to learn to play the violin, as Dr. Nowbath suggested, although I'm, during this time, but I'm going to give it a go. But we start to look at reducing that. We also don't necessarily go cold turkey. I don't think this is necessarily the best time to try go cold turkey. And so we start to cut down more gradually. If you can, reduce it by a third for a week and then come down from there. But critically, the worry for me is that, and it's not a free self-help tip, but it's a worry, is that we're criminalizing behavior that doesn't need to be criminalized. In that folk, when they go through these tips and they can go through these steps, they are still going to fundamentally bump into the fact that they may not want to stop. They may not be ready to stop in this place. And so that's going to undermine a lot of this until they're ready to stop and they can see a benefit. No one's going to want to stop doing something that they find pleasurable. And substances are pleasurable at some level. That's the problem. Of course. And so what we are now doing is we are effectively, unwittingly punishing folk, but we're also putting this at the level of criminality that is more commonly associated with illicit drugs. And so it means that we're exposing an already at-risk population to further censure, which is not something they need. And so I've got to put that as a framework around the free self-help tips. But to come back to that is have a look at your daily intake. It has to be seen as more of a treat if you look at alcohol right now. The temptation that is going to be there, I think, is that if they lift this at whatever level, is that we're now going to go back and use at a significantly higher level than we're probably comfortable with now. And that worries me from a rebound effect point of view, is that what we tend to do is when we stop, we stay stopped, but when we use again, we don't go back to using at the level when we first started using a substance. We tend to go back to where we stopped. And that is not necessarily we can tolerate. So we've got to build that into our thinking if we're going to slow down and stop, is to be aware that the desire to jump back in and just kind of go crazy is going to be to dampen that. There's not many free tips there, I'm afraid.
And I think it's also important to highlight that it's not just so easy just to stop and go without. I mean, it has physical impact. It can have, be really severe and quite an emergency case. So I think that's also something. It's a serious physical illness, and that's not just something that you can kind of detox. You're needing support and help. I want to just pose one. Yeah, I just want to pose one more question before we go to the chat and start answering the really important questions that have come forward. With regards to post-lockdown, or should I say a post-lockdown alert level 4, do you believe that there's been a more increase in illegal trade of substances, alcohol, cigarettes, so almost making the average person now looking for really interesting ways of getting? Is this something that is also adding extra pressure to already a society? Maybe Dr. Nowbath, I see you shaking your head.
I think, we can't ignore the economic challenges people are facing right now. Post-lockdown, with people losing jobs, there's going to be very little money left for so-called discretionary spending. How much do I spend on cigarettes or alcohol or going to restaurants, going to movies? When's all that going to come back? And how many people are going to be able to do that? So that's going to have an impact on the way people see things going forward. If you've been able to successfully brew your own, you might well decide to stick with that for now. If you can grow your own cannabis at home and you have a joint from time to time, as opposed to getting out to buy a cigarette. Look, I know people who've cooked. I know people who've run out of cigarettes. But in this market, cannabis is still available. They get as much as they can. The dealers are still out there. And they're getting that, and they're using that twice a day to tide them through this period. Now, as far as illicit drugs is concerned, I just want to mention a project that's going on. You touched on NGOs. We have a whole lot of homeless shelters in Durban, and many of the homeless people are Wunga addicts. Wunga, Joburg's Niope, sugars in some areas. The active ingredient there is heroin. Now, people on the streets of Durban, lots of them are Wunga addicts. They were moved into shelters. And the problem there was that these people are going to go into a withdrawal, which is severe. What happened is 2 people, Monique Marks from the DUT and Shakir Salduka as a psychiatrist, got together. They set up mobile clinics in these places. They've got a supply of methadone, which is opioid substitution treatment, and other packs to take some analgesia, something for the nausea, something for the pain and myalgia that goes with it. And these clinics have been running there from the start of the lockdown, and many of those patients or people in there have now come off heroin because they had no access. They've been given methadone to tide them through this process, and a whole lot of them are doing extremely well. It's a significant project undertaken here.
I think it just shows you when NGOs and the power of NGOs in helping the community. So that's really great to hear, and hopefully that there's more programs like that, not just because of COVID, but post this. I'm now going to start answering.
Just jump in quickly. Let's just reflect what Nob was saying earlier as well. He said, I had a patient as recently as yesterday say to me, and he's a long-time cannabis smoker, and he said to me after the session he was going to possibly go and buy cannabis. And I said, well, aren't you worried about that? He said, no. He said, as long as I'm not caught buying cigarettes, I think I'm going to be okay. And it was indicative to me of some pieces that like the economy has shifted. There's a shift in that.
Yeah, it's really profound. So thank you for that. Okay, so I'm going to go to some of the questions in the chat box. And Serena is asking, is it true that cigarettes prevent the COVID-19 infection? Dr. Nowbath, can I propose that to you?
Good Lord. Haven't found randomized double-blind controlled studies to suggest that. My own theory was that a whiskey will wash it down because whiskey is alcohol, But no. I honestly, I think it will aggravate anything. Simple. It's a respiratory virus. It affects things. I don't think there's any evidence that smoking will prevent or sort of burn up the virus. An interesting thought, but.
There's one question here for you, Neil, and perhaps this is something that we can make available to all our attendees. Just to remind you, we are recording the session, so everyone will get a link with the video link probably in the next day or so. Neil from Peter, is there an evidence or research on what you're saying about violence with alcohol running out?
No, that's, like I said, that's anecdotal. That's based on what I'm seeing. That's based on what I'm seeing in my practice. There's certainly nothing that I've seen that would suggest that.
Was that violence with alcohol running out? Well, we've seen
we spoke going through withdrawals,
violent behavior out there. If you go around the place, people have broken the bottle stores, stolen liquor from their certainty.
A question here is, with no cigarettes, are more people resorting to smoking dagga, which is just what we were talking about now, as that appears to be more readily available? And
I couldn't comment, but I certainly think that's happening on the ground. And I've spoken to people who are doing that. So.
Well, I mean, the argument that's being put forward as well is that by a lot of folk to me is that, but at the moment, cannabis is more legal than cigarettes are. So I run less risk of doing that. Not everyone is confident in terms of their horticultural abilities, though. I don't think so. I'm not 100% sure people are really, going to start growing massively.
Another question here, did the ban on tobacco products provide the smoker with an opportunity to at least consider making the decision to quit? Cold turkey is the most effective method of quitting. I've been trying to promote quit and quarantine. Opinion, your experience, or reality on the ground?
I certainly think that happened to lots of people. There simply wasn't any cigarette available. You couldn't go and buy cigarettes. You're forced to go through that period. You're forced to go through it cold turkey. I quit cold turkey myself 9 years ago. Stopped. But you're forced to go through that. So for many people, it's a good time to quit. And I know people have done so. The only problem is what happens. They've almost been forced to do so. What happens post-lockdown? Do they get back? Do they go back? Or have they almost seen the light? I hope it's the latter. Yeah.
So. I agree with you. I think my concern with it is just that. Is that I'm sure you have through the years as well, seen a number of folk, for example, who have been told because of a relatively sort of short-term or medium-term medical condition or because of a work-related concern that they have to stop a supplement and are able to do that. Also, New Year's resolution, whatever the case might be, and are they in a position where they do. But once that is lifted, there's kind of a reboot. Not in everyone, but that's my worry with this. It's just that there's not enough of an emotional buy-in. Hopefully, as you're saying, what they're seeing is that their sleep is better, their irritability is better. There's a whole range of physical and physiological changes that they're going, hey, this is a good payoff. We'll continue with that. And here I reflect back to, and again, it's just my own experience, but having, when I first started working in rehabilitation centers, what really worked was that you were kept away from the drug physically for a lengthy period of time. But your relapse rates were still quite high post-discharge. When we addressed the deeper psychological functioning and the broader social systems, those relapse rates, dropped. But there's benefit to not being exposed to it. There's tremendous benefit, and I think it's, am I going to take this as an opportunity? And that's where family comes in, and this is where the folk around them are really important. Is where family members can build into that by saying, "Hey, we are seeing such a difference in you. We're seeing such a change in you. We're benefiting from this. We're not inhaling your secondhand smoke, and we're not taking all those carcinogens in ourselves, or we're seeing that your mood is better. We're going for walks now. We're seeing such a change." And so this is what families have to do: is build into something positive, because we can arrive at a good space, unintentionally. It's what we do with it when we get there.
And you're saving a lot of money, and you smell so much better.
There we go. Some of the benefits. We have a question here from Laureen or Lauren. Sorry if I'm pronouncing it incorrectly. Can we hear more about the effect on binge drinkers, please, especially during lockdown?
The problem there is that binge drinkers would drink from time to time. They're not dependent on a regular fix. They go through, they have a trigger, something goes on, they binge, and they go on, drink for a couple of days, and then they stop. So for those people, this is not going to have all that much of an impact. I don't think anyone craves and misses that regular binge. Yes, there are people who binge on a special occasion, they're gone without it. But they're not dependent in that sense. So for me, that's not really a major issue, the binge drinkers thing. So, binge drinking is bad for you. It's been said to be tantamount to substance use disorder, but they cope much better with this, really.
Yeah, I agree with that. I'd say if you look at their coping skills between binges are probably better established in many senses, and so that's something they can do. And if I look at just anecdotally again, in terms of what I've been seeing in the last 2 months, that's been far less of a problem amongst those folk who have binge drinking patterns. They've actually coped better than anyone else.
Really interesting. We have a question here from Leah. For the like of the elderly who are already battling with the likes of emphysema, is the detox of not smoking not making it worse for them? They're not for smoking, but they're just concerned about those with those conditions. Maybe Dr. Nowbath, I can pose that to you.
The problem is I don't know what's your definition of elderly. Now, am I elderly at this stage? Or do I get elderly when I get to 70 or 75? But
that's for another webinar.
The age is not really the cutoff factor. I spoke to a surgeon many years ago who said, I'd rather operate on a fit 80-year-old than an unfit 40-year-old. Now, if someone has emphysema, chronic bronchitis emphysema, certainly smoking, they ought not to be smoking for starters. Right? So that part of it will be taken care of. They'll do much better physically. But what happens is by the time they've gone to that stage, right now, they depend on cigarettes, they depend on their fix, and they're at an age where they say, well, let me have a cigarette. It doesn't really matter. I've got emphysema anyway. They're also at this stage in lockdown, separated from their social contacts, separated from loved ones and family. They're locked into a situation that they're struggling there. So at some level, yes, medically, they'd probably feel better off physically. But in terms of mental state, you don't help that very much at all. No. It's the wrong time, as we said earlier, to start stopping people from cigarettes. And for them right now, a cigarette and the odd drink would probably provide certainly a measure of comfort.
No, great. I've got another question here and just to remind everyone, please to go and fill in the poll. We will be closing the poll very shortly and I'll be able to give some of the results. From Nomta, is there a bigger problem that people, because they've suddenly been criminalized, do not commit themselves for treatment or go to hospitals, but instead suffer their symptoms in isolation and without being honest about them? Are we finding, because of the stigma that's been put on people who are drinking and having to stop smoking and now criminalized, as was mentioned earlier, are we finding that this is preventing them from coming forward for help? Has this also increased the stigma?
I don't know. I mean, I'm not convinced that may be true. I think that in reality that the criminality associated with these things right now is probably quite short-term and small scale. I think that in reality, folk are battle with the stigma around alcoholism anyway. People battle with the stigma around difficulties anyway. I don't know that I've certainly not had anyone come to me, and the colleagues that I've spoken to, I've canned or spoken in the last few days that have had an issue with that, and folk kind of going, you only have to look at Facebook to see how many folk are quite happily selling these substances. So I'm not entirely sure there's a criminal sort of stigma attached to it.
Okay, we have another question. To what extent has the reported reduction in some categories of violent crime been due to or influenced by the ban on alcohol? Does anyone like to take that on?
One would guess that certainly people are drinking less, and alcohol disinhibits people. They drink at this stage far less than they were drinking previously. They're not gathering in taverns and pubs and shebeens outside. So there's no social contact and mingling there. That's where people drink and have a couple of drinks and drink too much and have a fight or have an accident on the way home. So that level, certainly that's being policed and taken care of. So there would be much less by way of alcohol-related violence out there because people are not drinking. And you've minimized mobility and you've locked people in. So that's not going to happen now.
If you look at the general level of stress and sort of concern around increasing dysregulation of mood, I suppose, as lockdown goes on, is that that's not going to be exacerbated, from that perspective. It's a very debatable statistic. I know that some folk band a percentage around of about 60% of crime is in some way related to alcohol or some sort of substance. There's a lot of debate around the statistic. The reality is that of course there is a connection to some degree, and of course we'd expect that to drop. We would hope that would drop with lower exposure. Because of the disinhibited
not moving around. So less chance of that. chance of a thing, and
Absolutely.
so it's going to be a confounding variable that's there, so you can't really.
Yeah.
Really interesting. We have a question from Gillian. Have any other countries banned tobacco or alcohol under lockdown?
Not that I know of.
Not that I know of.
Not that I know of. No.
That's what I can see.
It's really interesting. I think we have another question here. And probably this is for you, Dr. Nowbath, being the psychiatrist, from Candace, can one take these scripted drugs that you've mentioned to stop smoking if they're on antidepressants? Heard it could also make one aggressive.
There's the old story that one of the drugs, varenicline, caused neuropsychiatric symptoms and increased agitation, irritability, but subsequent studies have found that was not true. Because initial work was done in a group of American war veterans, which is a specific group of people, and they were prone to aggression and violence anyway. But these drugs now certainly are safe to use, have been used, and work effectively in getting people as part of a package to help people stop smoking. And lots of people have given up on it.
Thank you. We have another question from Colleen. Isn't there going to be an increase in drug addiction because of the alcohol ban? People might be substituting and finding themselves addicted to drugs now because it's readily available.
Difficult one to answer. Very difficult. I think people, once the lockdown's lifted, and if you're a problem drinker, alcohol is your specific substance of choice, and that's what you use. You're going to go back. I can't say that you develop a cross addiction to one thing possibly, and that's the benzodiazepines, the group of drugs like Valium, Ativan, Rohypnol, and Rivotril, which are used as part of a detoxification in patients who go off alcohol. So when you pull a patient, an alcoholic, and you detox him, you get him off the alcohol. The most common cross addiction is a benzodiazepine, which is a prescription drug. So that's a wondrous thing. As far as other harder drugs, I can't see that happening.
And I would toss in, just for discussion around that, would be the fact that there's sort of cultural traits or characteristics that go with particular kinds of drug use as well, that prevent some of the kind of cross addiction that you might think would happen. There are particular kind of levels of cultural identification with particular drugs as well. I don't know that, and I think if this were to continue indefinitely, I suppose you might see, if this were just the ban to continue indefinitely, you may see folk in some ways starting to sort of move across sort of drug boundaries. But I've not seen that consistently over time, in practice. I've not seen that, and I can't see that would necessarily develop now.
I think also one of the interesting things that have also popped out, and I think this is a conundrum that I often hear, and whether it be support groups or in communities, especially the link between mental health and substance abuse. The dual diagnosis, what came first, the chicken or the egg. And in something like this, where we're both compounded by the mental health issue as well as the substance use issue, what do we start tackling first? What do we start dealing with first? Maybe we can just unpack that briefly.
Well, I suppose the lockdown, in some senses, was answering the chicken and the egg question for us. In a sense, is that we're removing the substance now, and so we're left with all the emotional fallout that goes with that. So, to some extent, I think we're going to have to work with that first. But it's very difficult. You don't really ever, I think, Dr. Nowbath would either agree or disagree. I don't think you have high level success if you don't focus on one and not the other. Can you unpack them and see them as such discrete entities? You can't. I think we have a somewhat of a unique situation.
Yeah, especially if there's a dual diagnosis. You do both simultaneously. Clearly, a patient who comes in a full-blown withdrawal, you're going to focus on that and settle him because you can't work with him otherwise. But if you don't treat the comorbid depression, anxiety, whatever, you've got two different kinds of conditions. You've got substance use conditions and substance-induced conditions as well. And you've got to do that simultaneously. I can't see sort of separation there, no.
I think Sorry,
I do think that, what we're left with at the moment, certainly, we're seeing it. The very basis of this webinar is that we're seeing the emotional impact of this. And so we have an opportunity now, and I think it's an opportunity to, especially in families and households, is to go, hey, with this thing removed, what do we have? Can you see the impact on us? So it's a flash where the chicken is kind of, watching the egg from a distance, and let's do something with it. Let's focus on that.
Yeah. Another really important question here, before I go to the poll results, it's from Caitlin. I know that the alcohol ban has helped hospitals as there is less alcohol-related violence in cases that are in emergency units. Do you worry that lifting the ban will result in a huge increase in these cases and the burden on these healthcare facilities, especially during COVID?
I think lifting the ban is going to come in stages. I don't think there's going to be a sudden open everything up and you're free to go and roam. You're not going to go from level 4 to level 1. You're going to go gradually through that process. And even with lifting the ban on sales of alcohol and cigarettes, it's going to be a staged opening up. It's not going to be suddenly everybody's free. And there's going to be no total anarchy. I can't see that happening. So at that level, I think people are going to be sensible about it and go through and get back to the relative, to the norm. If there's ever going to be this will be a new normal, we know that. But we get back slowly to that level. I can't see floodgates suddenly opening now.
I can't see that being helpful at all. I agree with you. I mean, if you look at it, like I said, the folk will tend to go back to. I think you're going to find, if they give you a daily limit of, I saw something in the media the other day, 120 beers per person per day, which even coming from Benoni would be somewhat extreme. Not sure. I think folk are either going like weird. I hope that's a typo, but there's some folk going, win, that's kind of, this is where I'm going to be. But I still think we're going to see something, I'm going to get my aunt to go in and go, listen, go get your 120 beers and then share them with me. I just can't see. And I think financially,
people don't have the resources to do that. In the liquor store the day before the lockdown started, and every 2 minutes they announced the shop will be closing for 3 weeks come Friday, and people just kept on putting stuff onto trolleys. It's not going to happen going forward. People simply don't have the money, don't have the thing. You're going to get back to work, you're going to spend your money properly. It's not going to happen, except for the privileged few, So that's where we're at.
So I think also the interesting results from the poll. So the question we asked is, how do you feel about a graded lifting of the cigarettes and alcohol ban, which we've just touched on now? We had 26% say, yes, it's about time. We had 17% that say, don't care, it doesn't affect me. 19% that cigarettes first. Only 1% said alcohol first. It is a Friday afternoon. And then 34% said both cigarettes and alcohol ban to be lifted together. So really interesting. Thank you, everyone that has filled in the poll. Is there any comments you'd like to say on those results? Anything surprising, expected?
What was the last figure? Cigarettes and alcohol together?
Both cigarettes and alcohol ban to be lifted together was 34%.
Okay. It's interesting. Smokers in the market. It's much easier at some level. If you drink socially, you drink like most people drink out there. You're more dependent on your cigarettes. And the cigarette smoker smokes, you don't get up in the morning and have a beer or have a whiskey in the morning. You drink at specific times. Many people get it more, and the first thing they do is a cup of coffee and a cigarette. They go through the day reaching out for a cigarette. So I think it's understandable that most people out there, smokers out there, would want the smoking ban to lift straight away. It's a far more difficult thing to quit on the turn, certainly. It makes sense.
I must be honest, I agree. I don't get surprised by the result, to be honest. And that's backed up with just the fact that I've spoken to, through times, that I think it's woven much more into the daily life of the smoker than anything. And so that loss, that thread that's been pulled is going to be very difficult to cope without. So I'm not surprised. And a very strong voice among smokers, I think being polite and putting it that way, there's a very strong, strident voice.
I think as we're coming into, it's amazing how quickly an hour can go past and how much we can unpack on this. We can probably spend the whole afternoon really discussing and debating, and the questions are still flying in. I want to reassure everyone, even if we weren't able to get to your question today right now, we will be able to answer this post the webinar, or when we send you the link. We will take the questions. I'll ask our experts to help us, and we will answer these key questions for you as well. So do stay tuned. If I can pose to you now, if you were sitting in the nerve center with government and with the ministers and policy decision makers, what would you suggest as the next level with regards to addressing the alcohol cigarette bans, But as well as the substance abuse and mental health, what would be your recommendations or your input that you would give to the people making these decisions? No pressure.
Good Lord, what a question.
Dr. Nowbath, I can't wait for your answer on this.
For me,
Great.
For me, the lockdown was never meant to be punitive. We never intend to create a nanny state where government polices and is overprotective. And the other bit of advice I'd say is that the lockdown was never intended to perpetuate the human rights abuses that we've seen on the streets, with an overzealous police force and SANDF, with the attempted arrest of a 4-year-old, with man being killed at home for consuming alcohol. I think these are issues there. And there are other priorities. We need to get the economy going, get people are starving on the streets. It's crazy. We need to get food parcels out, proper financial aid, rather than worrying about what someone sitting in the privacy of his home is going to do, having a bottle of whiskey, a glass of wine in the evening, or having a cigarette out there. I think there are far more priorities that should be focused on by the Command Council. So certainly I believe it should be lifted in a graded manner. That's my thought.
I'm going to echo that. I think that we should, I would advise them to not underestimate the basic cognitive ability of most folks and the capacity to make good and balanced decisions. And I don't think that everyone's going to go out there and buy 120 beers a day and consume them all in one go. And that what we need to be mindful of, I think, is the possibility of almost a shadow pandemic, which would be the mental health pandemic. And that we shouldn't be exacerbating problems and creating a secondary issue when this can be quite easily, I'd say easily, I mean, I'm naive, I'm sure, but quite intelligently dealt with in terms of getting priorities right. And I would support what Dr. Nowbath said, is that I think there needs to be a gradual lessening and lifting of restrictions, because we need to be human and humane in this whole process.
And I think that's to echo again your sentiments, is that we've seen the research, we've seen what's been happening overseas and the impact on mental health. And obviously, again, substance abuse is profound. And I think, looking that COVID is going to be with us for at least 18 months, it's really important that we use this opportunity to make mental health a priority and all of its impact. If I can ask, I know we're about to end it, and everyone is still asking amazing questions. And again, we will get to them. Any last closing comments with regards to the topic of the impact of substance abuse, cigarettes, or alcohol on mental health? And any last words for everyone attending?
Neil, go first.
All right. I think it's about, if you're a family member of somebody who's going through this, let's please understand, and I've seen this time and again, is that families with somebody who's got an addiction to an illicit drug has suddenly got a family member who's not had access to cigarettes, so suddenly that family member who smokes is going, I understand your addiction better, I understand your process better now. Let's have a sense of gentleness and compassion for each other in this time. Let's have a sense of understanding that this is an extraordinarily difficult time, and even more so for folk without that the impact is known, it's identifiable, and it's been well documented. We need to be clear about that I can't see that this is going to improve mental health functioning. And I could just hope that there's going to be wisdom and a sense of compassion all around. That's really what I
echo what Neil says, and I just hope there's a measure of sanity that comes to the table right now.
Thank you so much. I really appreciate your insight and being open to this discussion. I think I've learned a lot, and the people that have joined have really, really enjoyed it and found it really insightful. I know that you are all busy, seeing patients and still helping. So I appreciate your time in your busy schedule. And to all those that joined us today, I really do appreciate it. I do urge you that the discussion does not end at the end of this webinar, is that we continue to take this forward in our households, amongst our next Zoom work meeting, so that we continue to learn and start the discussion and learn more about this really important topic. So to everyone, thank you very much for joining. Have a wonderful rest of your afternoon. Look forward to the link, and please join us next week. We have another webinar that we're doing on the mental health impact of essential workers and healthcare professionals on the front line. So please do join us same time next week. Please look out for the Mail and Guardian website to register for that important webinar. And again, to our sponsors, Dr. Reddy, thank you so much for giving us this platform and the opportunity to have these discussions. Have a wonderful weekend, everyone. Thank you. Bye-bye.
Bye-bye. Cheers, Cassey. Bye. Okay.